यत्र ज्ञानं चिकित्सं करोति नैतिकता मार्गदर्शिका भवति तत्र असुदं पवित्रं भवति, which means where knowledge heals and ethics guide, medicine becomes sacred. Good morning, ladies and gentlemen, esteemed guests, respected dignitaries, students, PG scholars, and all practitioners of healing science, and our sponsors of today's seminar. I extend a warm and respectful welcome to all the esteemed principal of Government Homeopathic Medical College, Bhagwan Buddha Homeopathic Medical College, Rosie Royal Medical College, and Anuradha Homeopathic Medical College. We are truly honored by your gracious presence today. Today, we gather to commemorate a day of great significance, World Homeopathic Day, celebrated in the honor of our visionary, the reformer, and the founder of homeopathy, Dr. Christian Friedrich Samuel Hahnemann. This day is not just a tribute to the system of medicine, but a celebration of philosophy, one that upholds healing as a heart, grounded in empathy, science, and the uniqueness of every individual. Each year, we are very proud to witness new growth in homeopathy, right from the research in successfully treating medically integrated cases, and not just that, milestone, even the release of a documentary film in Netflix that beautifully captures the journey, impact, and global relevance of homeopathy. And today, as a part of celebration, we are here not only to honor our history, but also to shine a light on how homeopathy continues to transform life worldwide. Scientific session. With this, let's head forward to the commencement of the first scientific session. It's our honor to have with us today a highly distinguished figure in the field of homeopathy, Dr. Madan Sir, Emeritus Senior Homeopathic Physician, who will be leading this session with his vast clinical insight and decades of experience. Presiding over the session as chairperson is the esteemed Dr. Bindu Sharma, Assistant Director of Homeopathy from Central Council for Research in Homeopathy under the Ministry of Ayush Government of India. Joined the CCRH as a research scientist and worked as an investigator for many research projects. Also headed the documentation and publication section of CCRH for nearly a decade. And worked as editor in Indian Journal of Research in Homeopathy and Council's newsletter of CCRH for 9 years. And joining him as a co-chairperson is the respected Dr. S. Siddiqui Ahmed, former medical director of S&M Hospital, Bangalore, former principal and medical superintendent of Bhagwan Buddha Homeopathic Medical College, presently working as a principal and medical superintendent in Rosie Royal Homeopathic Medical College, Bangalore, former Board of Studies member of Rajiv Gandhi and Calicut University. We are excited for a warm welcome to all three dignitaries and invite them to take this academic session forward. May I request Dr. Satyavati, Treasurer of KHMA, to kindly present a floral bouquet as a gesture of our gratitude and respect for the dignitaries on the stage. Ahmed to introduce our first speaker of the session.
A very good morning to all the delegates, dignitaries on the dais, principals of all the homeopathic medical colleges here. In fact, Dr. Madan is a well-known person here, which is really everybody knows, and he is very famous here in whole Karnataka, not only in Karnataka, and he is also working for the outside the countries also. Sir Dr. N. Madan Professor of Emirates in Homeopathy. Sir is BSc from Bangalore University in 1978, and he got degree in homeopathic GCH. That is, it was a very old degree, Graduate Court of Examiners in Homeopathy, which he has completed from A.M. Sheikh Homeopathic Medical College, Bangalore, in the year 1984. Sir has started the homeopathic career as a physician under the able guidance of late Dr. A.V. Krishnamurthy in Ashwani Homeo Clinic, which was there in Basangudi, Bangalore, till 1996. He did his MD in the year 2007 from Kashir Sagar Homeopathic Medical College, Bid, Maharashtra, which is affiliated to Baba Saheb Ambedkar University. He has joined Bhagwan Buddha Homeopathic Medical College and Hospital, Malathalli, as a lecturer in the year 2007, and he was there till 2011 as a lecturer. After that, he has continued as assistant professor till 2013. Then he continued as a professor and HOD of Department of Surgery till 2020. Sir has been conferred with the Professor Emeritus in Homeopathy by Rajiv Gandhi University of Health Sciences, Bangalore in 2020-21. Sir was also been awarded with Vaidya Ratna Award bestowed from the Bharati Mangalu of Sri Veerapaksha Devaranaya Mahapitam Hampi Kempegoda Award in 2011. In fact, he even has immense knowledge of homeopathy and agriculture, where he has helped lot of farmers and plant lovers by improving their yields. He also loved the pets, and he has helped the pet lovers look forward to him as he has cured many animals of their ailments from India and abroad. His regular OPD and IPD is at Nagpur, where he has a hospital and 3 clinics centrally located in the city. He even attended the patient online from all parts of India and abroad. Sir is a really very eminent and well-known homeopath in Bangalore. He has cured thousands of patients till date. He has been one of the best prescriber in acute diseases and also very eminent in the chronic disease also. He has taken a lot of challenging cases which was not curable in allopathy and which was been turned back, and it was in the last stages of their life. I honor you, sir, and respect you. And sir is here with all his with great his difficulties and his busy schedule also, he has accepted and came here. Sir, please welcome here. We welcome you here. And now, sir is here to take up the stage. Thank you. Thank you.
I request our chairperson and co-chairperson to kindly take the seat.
First, I thank the association for giving me a chance to share my experience, which may help the juniors and some of the practitioners in their practice. Today is my subject is infertility. Of late, the infertility cases are increasing, that too particularly after the vaccination. After the vaccination, we are seeing breast cancer, lung cancer, pancreatic cancer, endometriosis, diabetes, even the infertility. My argument with the vaccination is, how can one vaccination suit everyone when there are so many differences between the two children of the same mother itself? While vaccinating, there is no test to say that whether that particular person needs the vaccination or not. Third one, while vaccinating, they themselves have no guarantee that it will give protection to the particular condition. Recently, in America, the doctors are seeing, after giving the influenza shots to the children, the influenza chances are increasing and they are becoming more and more vulnerable to the condition. So many times they say, see, even your homeopathy medicines works like vaccine only. No. In vaccination, you can find out from which material it is made. It is still the material is visible. Whereas in homeopathy, it has gone to the potency level. You cannot see the material. Not only that, we don't give same vaccination to everyone. Depending upon their own individuality, we differ. That's why we see, I also in my lecture I will tell you why we selected particular vaccination, I mean the antidote for vaccination, when there are so many antidotes for the vaccinations. So shall we start with the subject? Infertility causes in female. One is the irregular menses, delayed menarche, dysmenorrhea, outflow of semen, outflow of semen from vagina after intercourse. This usually we have seen, even the gynecologist will don't consider this. But on this basis, after treating, even when there was oligospermia with the husband, we have seen conception has taken place. Logic behind that is, usually in the contraceptive methods, they use the withdrawal method. That is, before the ejaculation, they withdraw the organ. But in such peak orgasm, many times we have seen a drop of semen has fallen into the vagina and they have conceived. That shows for conception, one sperm is sufficient. Let there be oligospermia. But because even in normal spermia also, when the fluid flows out, that is the vaginal mucous membrane is not aligned properly, the conception has not taken place. Even in oligospermia, in many cases, after treating this outflow of semen, we have seen the very next month the conception has taken place. So while taking the case history, we give more importance to this first. If the vagina is not proper or if the semen is not going inside, how can the conception take place? So we have to correct the problem from this place itself. So, because many times even gynecologists don't see that the outflow of semen is not the problem for infertility. But we have seen in majority cases. So while taking the cases, first see outflow of semen is there or not. First that has to be treated. First I will tell you how we treat the cases. Later on I will show you few cases how the conception has taken place from our thinking. Many times we have thought out of the box also, because in many seminar I have I have shown the different methods of prescription, different approaches. Like we have prescribed on the basis of natural order, we have prescribed on the basis of PQRS, we have prescribed on the basis of doctrine of signature, we have prescribed on the basis of laboratory investigations, we have prescribed on the basis of empirical methods, whatever olden people used to do for such condition. For that, we have used our medicine instead of that method. But we have taken the information. Many times I will show you one case where we have taken the, not taken the means accidentally they had expressed that they had gone to a astrologer. They said you have to go around the ficus tree to get the for the success of conception. If you understand the pranic healing, they say whenever you are tired, go and hug a tree. That gives you the energy. What we deal with is the energy. So why can't we give the energy, same ficus energy with us, which we have ficus religiosa? After giving ficus religiosa, she has conceived. So we have taken that information also and prescribed. Any information is not a waste. Convert that to your system of medicine. Tubal block, ovarian cyst and poor AMH. Now poor AMH because of the cell phone towers. Endometriosis, as I told you, due to the COVID vaccination, it is increasing. Obesity. Side effects of COVID vaccination. The other, I will explain you these things in future. Heat in vagina, consanguineous marriage. Consanguineous marriage is not the cause for infertility. And not only that, the obesity is also not the cause for the infertility. If that is the thing, those who are obese should not have conceived. We have seen twin pregnancies in obesity. And infertility in thin ladies also. So that shows it's not the cause. Because many times if they don't get any reason, they attribute it to the obesity. But what I say is, if you are 100 kgs and get first prize in running race, that is your weight. So why should you reduce your weight? Each one cannot have the same weight. This much height, this age, this should be the weight, is done by the insurance people, not by the doctors. That is for their safety, not for your safety. And thyroid, of course. So these things I don't explain much because irregular menses, early menses or delayed menses, regularly irregular menses or delayed menarche. These things you can find with the repertorization. Repertorization is a must for all the juniors for minimum 5 years so that you get acquainted with the drug and the symptoms. Repertorization and the therapeutics is an exercise to get more and more acquainted with your materia medica and the medicine. So you must do it. Dysmenorrhea. Do you say dysmenorrhea is normal? How many of you say it is normal? Because gynecologists say, oh, it's normal, it's common. Common is not natural. Menses, like urine and motion, that is another excretion. As there are no discomforts during urine and stools, there should not be any discomfort during menses also. It is giving an indication. You have got 21 feet intestine inside your abdomen. The whole intestine moves 3 to 4 times per minute. Do you feel its presence? The moment the indigestion happens, either you get gurgling or squeezing. So that means it has deviated from its normal functioning. Same way your heart. Heart is beating 60 to 80 per minute. You don't feel its movement at all. The moment you feel the palpitation, you know there is something wrong with the heart. Any of our physiological functions should work, rather not, it should not work to your conscious. So any deviation gives the clue that it is deviating, so that correct there itself. And many times I have seen juniors taking the class dysmenorrhea. Mere dysmenorrhea don't give us any clue for the selection of our medicine. So you have to see whether there is abdomen pain or backache or both. The backache is only backache is there or extending to abdomen, or the backache is extending along the abdominal wall and come to the abdomen, or backache is going straightly from back to the abdomen. These differentiations will easily give the clue to select your medicine. So keep an eye on these things, these minute details. Just now I was speaking to Mr. Sharma. Every drug has the nucleus. To understand the nucleus, like every animal has its nucleus. The moment some animal is barking outside, we know it is dog. We don't doubt whether it is cat or something else. So every drug has the nucleus. To understand the nucleus, read one drug, first in Nash, same in Farrington, same in Kent, same in Clark, then Murphy, Tyler, Hughes, like that. But in this order you study, and Boric is last, because Boric is small book. If you read, definitely you will be in confusion. So don't read Boric first, read in this order. By the time you finish this order, you will understand the nucleus of that drug. So same way, when you start hearing your patients, they give the nucleus without their knowledge. Then you know which drug they are matching. So then it is easy to prescribe. So these minute details are necessary instead of just writing dysmenorrhea. Dysmenorrhea should not be there. Dysmenorrhea is giving an indication that the body is deviating from its normal functioning. If you correct that, then they will not lead to the either ovarian cyst or the fibroids. See, it is just for as an example how we differ. So more with the backache, more with the abdomen pain. So backache and abdomen pain, the viburnum, the backache extends along the abdomen and along the abdominal wall and comes to the abdomen. So that is viburnum. Whereas the pain extends directly from within to the abdomen is helonius. So these different minute differentiations will help you to select the opt medicine. Abdomen pain, many times they write abdomen pain, whether it is continuous or intermittent. If it is continuous, better bending double or stretching their legs. If it is intermittent, that is whether the pain is before the discharge or during the discharge or after the discharge. Before the discharge, better after discharge is lachesis. During the discharge and particularly during the clot is simicifuga. After discharge is more with nux. So these things give you the clue which medicine to select. What all the drugs I am telling, they are not only the drugs. It is only an example to make you understand how we can understand our materia medica. See, bending double is colocynth. Better stretching leg is diascoria. And during the pain, we also observe their behavior. If they are very irritable, it is with chamomilla. If they are more of stuporose, it is kaphia. So you can find the difference. So even your observation, their way of appearance, all these things will give you the clue for the selection of your medicine. Use of BCG in delayed menarche. Why I mentioned this here? Because a girl of 19 years had not menarche. But usually we observe for the BCG vaccination. That's my first experience with my senior doctor, Dr. A.V. Krishnamurthy. We had an asthma patient where we were treating with all the indications. He used to improve and it used to come back. Then during the physical examination, we found there were two BCGs because BCG started in the year 1968. When it started in the beginning, they started giving everyone, and next year also they started it. 25 years back, WHO told it is useless. 15 years back, ICMR told it is useless, but even today they are vaccinating. They themselves don't know why. So, because there were two marks of BCG vaccine, we thought it may be obstructing the reaction of our indicated medicine. We gave BCG. For our surprise, that was the first case. He improved in such a way that his asthma got completely cleared because BCG is a tubercular vaccine. Same way, in one girl of 19 years, we saw BCG, 2 marks of BCG. We give BCG 200, 4 times 4 days. Very next week, she had her first menarche rather. So, BCG is also more important. In many cases where it is not improving properly, we have seen after giving the BCG vaccination, it is getting the result. Because of late now you can see, whenever there is a polio campaign, the febrile convulsion cases are increasing. These febrile convulsion cases, what we have observed in majority of cases, before getting the attack and fever, child will be very active. One mother told me, see sir, he is so active today, we know definitely tomorrow he gets the fever, and once he gets the fever, even 99.5, he gets the convulsion. We are scared of it. So we got the clue here to antidote the side effects of polio. The clue is the active before getting the attack. This you will see in indigo. Indigo is a medicine for convulsion where the patient before getting the convulsion is very active. So we thought, why we should not try this? We gave indigo. Next time she told there is no fever and no convulsions. And they stopped, of course, they stopped the polio vaccine also. The other indication, usually I say, one of the videos I have done is Dr. N. Madan kitchen remedies. If you type in YouTube, you will see around 30 videos where if you take the statement of Farrington, similar families has similar action. So indigo belongs to the natural order Loganiaceae. Your tamarind also belongs to the natural order Loganiaceae. So what we did, when the patient is away from the clinic or on Sunday or when they don't get the medicine, I told them, drop a drop of tamarind juice in half liter of water, shake it well for half minute. You get millesmal potency. Start giving one sip every 10 minutes. Baby improved. Like that, the material. See, now there are pharmacies. Where were the pharmacies earlier? Doctors used to keep the raw material. Now we have the raw material. Why can't we prepare the medicine? We can use the raw material. That is why I keep telling the students, first, you while studying the materia medica, also see from which material it is made. Nange time helbeku ಸ್ವಲ್ಪ from which material it is made. That is why, so that you have the raw material, you can prepare the medicine at home itself. In one case of hernial pain, I had to give granatum. Where you get the granatum? Pomegranate. Why can't we prepare and give so that the patient could get the relief? In case of appendicitis pain, we had to give the Iris tenax. Iris tenax belongs to the natural order Iridaceae. Do you have the Iridaceae family material in your kitchen? No. Sure? Saffron petal, Crocus sativa belongs to the same group. In one case where there was a severe acute pain of appendicitis, could be corrected in the same way with the Crocus sativa. So, while studying your drugs, know its natural order. If it is an animal, know its behavior. If it is the the habitat of the plant that grows, all these things are useful for the selection and prescription of your drugs. So keep an eye on all these things, and also don't leave any information thinking that it is a waste. Every information is necessary, and you should know how to convert it into your materia medica. So BCG is also useful. BCG vaccination antidote many times helps in clearing the condition. In first, as I told you, the outflow of semen. First week is platina. Majority of the cases, one, there will be a dyspareunia, and also there will be outflow. After giving platina, we have seen outflow has stopped, and in many cases, very next month the conception has taken place. So for outflow of semen, the outflow of semen and dry vagina, the platina will help. And if you see the natrum carb also has the same thing, but platina has lymphomania, whereas the natrum carb has aversion to sex. Even after prescribing natrum carb, we have seen where the outflow has not stopped. Even if there is no lymphomania, after prescribing platina, the outflow has stopped and the conception has taken place. So we have seen platina has worked like genus epidemicus. Causes of low AMH. Stress level. Now you see, it is easy to say, oh, you are a software engineer, your stress is more. Even if the patient says, I have no stress, they say, no, you are having this stress because of your job nature. Age. If age is the cause for low AMH, I have seen the first conception and delivery at 41 years. Usually as the age advances, they say the quality of the ovum will come down. But earlier days, both mother and daughter used to go for delivery together. If age is the cause, that should not have had happened. Why I am telling this? Don't take their version as the gospel truth, because the speciality of this system is that we know the chronic disease, where the allopathy system has no idea of chronic disease at all. That is why for everything etiology unknown they write. Without knowing the etiology, how can the cause go? I mean, rather the effect go. Is it not? But if you understand the chronic disease, you can easily understand the changes in the body. To understand chronic disease, Don't read Hahnemann at first. Read Herbert Roberts. Then read Kent. Then read Sarkar. Then read Chronic Disease by Allen. Last you read Hahnemann, then you will understand. Otherwise you will feel Hahnemann chronic disease is a very dry subject. But it is a wonderful subject you really enjoy in your practice. I will show you how it works. Vitamin D deficiency. Usually they say because you don't go outside, your vitamin D deficiency. Now the business is going on with vitamin B and B12 and D3. If the sun is the only cause for the deficiency of vitamin D, we have seen even in the building workers, those who work from morning till evening in the sun, their vitamin D is also less. Many ladies, those who are working only in the kitchen, their vitamin D is normal. In such deficiencies, as I told you, any knowledge is not a waste. We started giving calotropis to improve the vitamin D, because you must have seen calotropis plant, Ekkadgida. In Ratha Saptami they keep on the shoulder, and also it even in astrologers say your sun is in the horoscope is weak, you do puja to this calotropis plant. We have seen, as I told you, it is an energy which is representing sun on the earth. Why can't we give calotropis? After giving calotropis, we found their vitamin D has improved. Same way with B12. Usually they say because you are a vegetarian, your B12 is less. We have seen even B12 is normal in vegetarians, and even in non-vegetarians vitamin B12 is less. But in all the cancer cases, even before the onset of cancer cases, if you check, their vitamin B12 will be 3 times more than the normal. Actually it should be 900, their vitamin B12 will be 2500 and 3000. Can't we clearly analyze that the cancer cells produces abundant vitamin B12? In many cases of cancer, where they have in the earlier they have detected as vitamin B12 deficiency and started giving injections, after 6 to 7 injections they have detected cancer in them, because vitamin B12 contains cobalt. It is cyanocobalamin. It contains cobalt. We have seen cobalt has stimulated the cancer cells. So after many times, particularly the backache after taking the vitamin B12 injection, the main indication of vitamin B12 backache is while getting up they get the pain, while sitting they get the pain, while walking they don't get the pain like Restux. In fact, one of my close friend who has 6 FRCS, we can make menu card from his FRCS, but he is the best urologist and unnecessarily don't do surgery, and he do the surgery. If any poor people says that I have no money, he says don't pay my fees. Such a humble, godly man. His wife had this problem. I asked him, have you given her vitamin B12? Yes, from 3 months she is taking. Since when it started? From 1 month it started. So I told him, first stop and see. After stopping, that backache has come down. So vitamin B12 backache is the indication is this. Wherever there is a vitamin B deficiency or more of vitamin B12 readings, we have seen after giving cobalt, their things has coming down. And particularly where they have this tendency of cancer, we have seen this, they have observed one thing, that non-vegetarian supplies vitamin B12. So we found Wherever there is an aggravation from taking non-veg, after prescribing cobalt, even after taking non-vegetarian, there is no allergy. So these informations will give us how to use our cobalt. Eating habits. Eating habits, of course. The youngsters has to eat the, what do you say, junk food, because we can't eat it now. At least we had something to say what mischief we did in our younger days. Now, if you don't allow them to eat even junk food, they have nothing to express that they have done all these things. I keep telling the youngsters in my clinic, if they don't do it, I tell them first do it. So those things they have to do it, one thing. But eating habits should not be excess. Everything should be moderate. Anything. It is too bad to be too good. So I tell them, let everything be moderate. And many times the patient says, can I eat this? I say, if that suits with you, do it. Because I got the cold from taking banana, I can't prevent you from taking banana. Your body nature is different. We had a asthma patient. Whenever he gets the wheezing, if he take a cup of ice cream, he used to feel better. As the ice cream descends, he was getting relief of his asthma. He gave us the clue regarding that. Any medicine? Mephitis. Mephitis has this. And another patient, he used to say, I will be waiting for the winter season to come. In winter, my asthma gets cleared. Usually in winter, it is more. But his nature was, he was feeling better in winter. So Ilex aquifolia cleared his asthma. So these things, like this, they give the clue without their knowledge. But if you have the knowledge of your materia medica, nothing is strange for you. So do repertorization, do therapeutics, so that you will become very well acquainted with your materia medica. Medical history, of course, depending upon the family history. Usually in medical history, many times I have seen juniors, they write family history, NS, not significant. It is easy to write. But for us, family history is more important because that gives us the clue of their miasmatic background. So we must ask in your direct blood relations, like father, mother, their brothers and sisters, the patient's brothers and sisters, their uncles and grandparents. So among all these things, first tell them what are the blood relations you need. Because when you say in your blood relations, my wife is having, they say, wife is not a blood relation. So in blood relation, then tell them what are the conditions one by one and give them few minutes. Anybody having asthma, diabetes, BP, thyroid, skin condition, joints pain, hysterectomy, mastectomy, cancer. So if you give them some time, they think and tell you, or even you can tell them what all you have asked, let them keep in their mind and report next time, because they don't know what you need. Because by the time they come to your place, they have visited many allopaths, they see the reports and leave the patient. I keep telling, the report is from you, you are not from the report. I need your nature first, then this. So take the family history properly so that you get the miasmatic background. Birth control pills, of course, because it changes the whole hormone balance, and there are chances of disturbing your whole ovulation process and gets you into the infertility. Obesity, as I told you, obesity is not the cause. We have seen many obese ladies have conceived after our medication, and if that is the thing, all the thin ladies should have conceived. But thin lady, the infertility is in lean ladies also, fertility in obesity also. So don't take these things, because these are the things told by the allopathic system of medicine, because they don't know the miasmatic background. Say, as I told you, consanguineous marriage. Consanguineous marriage is if that is the cause, there should have been mentally retarded children or infertility in all the consanguineous marriage, and they should not be there in non-consanguineous marriages. We have seen in consanguineous marriage, it is more because from both the side you will see the syphilitic miasm. That makes the infertility more firm in consanguineous marriage, but for that it is useful, not the consanguineous marriage is the cause for infertility. It is the syphilitic miasm that present in both the partners is responsible for infertility. Symptoms of low AMH, early menstrual cycle, amenorrhea, and early symptoms of menopause. Of course, this may give you the clue for the AMH, because of late the AMH is coming down. Anti-Mullerian hormone level is coming down due to the cell phone towers. Because we found this first case, in one girl there was a metrorrhagia. On all the symptoms we have prescribed the medicine, still there was no improvement. Then she herself expressed, I am in an apartment, just above my room is the cell phone tower. Can this be the cause? Then we thought the cell phone towers produces the electromagnetic rays, because we have seen electromagnetic rays affects the pituitary, where thereby the whole hormone system get affected. So we have the medicine made from the magnet, that is magnetic poli ambo. After prescribing magnetic poli ambo, with each dose her discharge came down. Now wherever there is the infertility and the AMH is low, we are seeing the magnetic poli ambo is bringing back the AMH level to the normalcy. So this is also more important. That's why while taking the case history, we ask any cell phone towers around your house, at least 500 meters away from your house. So this is also more important. While taking the case, keep an eye over this. Now, because of the vaccination, the hemorrhagic cysts are more. The hemorrhage, we have seen the Crotalus horridus has the hemorrhagic cyst, and we are selecting Crotalus horridus particularly for the antidote for present COVID vaccination, because now you have heard there are clot formation and dying due to the clot, and paralysis due to the clot. If you check their CBC, their platelets are increasing more than 5 lakhs, which is causing the clot. And in many cases, the platelets are coming down. Even though the dengue is negative, but the platelets are down. We have seen after the Crotalus horridus has the tendency for hemorrhage and affinity towards the platelets. That's why we say in majority of the cases, we have seen after prescribing Crotalus horridus, their platelets has come to the normal. In some cases where it was low, it has come to the normal. So Crotalus horridus, which causes the hemorrhagic cyst, even in abscess, where there is an hemorrhagic abscess, after giving Crotalus horridus, or the medicines made from the vipera, they are improving. Whereas the common cyst, simple cyst, is getting corrected with Bovista. Blocks. In many of the thing where after the ectopic pregnancy or due to a pelvic infection, we are seeing these blocks. So for such blocks, as I told you, the genus epidemicus, medicine made from mustard oil is clearing the scar, because the medicine made from the mustard oil has the capacity to dissolve the scars. The medicine made from mustard oil is thiacinamide. Thiacinamide has the capacity to dissolve, and in many cases, because we have a friend, gynec friend, whenever she finds the blockage, just she will go to Dr. Madan and get it cleared and come back. And many of the infertility cases, one problem we are having is, after treating all these things, the moment they got conceived, they have not come back because they have gone to the gynecologist. And later on, some other time, we found that their pregnancy was complete and delivered. So it is the thiacinamide which helps. I have not written thiacinamide because just to make you understand that this we have in our kitchen, and you can use this for another complaint also, mustard. Mustard belongs to the natural order Cruciferae. It got its family name Cruciferae because its petals are crisscrossed. So from that it got the name Cruciferae. Your Iberis also belongs to the same group. Sinapis nigra, Iberis, all belongs to the natural order Cruciferae. So whenever the Iberis is necessary, why can't we use the mustard and prepare your medicine immediately till they get into the hospital? Is it not? Heat in vagina. That also we have seen in cases of infertility. Because of the heat in vagina, we have seen sperm get spoiled or die due to the heat. Either many times the husband has expressed that the vagina is hot, or many times after touching the hand, we can feel that it is very hot, and that heat gives the clue for the sensation of, for the selection of borax. If you read in Boric, he says easy fertility. So for the indication for borax is this: they feel very hot. Not only their leukorrhea or mouth is hot, even their body will be overheated. That gives the clue for the selection of borax. Endometriosis will not form in overnight. So all these dysmenorrhea gives us the clue that we are going to deviate from the normal and produce either fibroid or endometriosis. Even the endometriosis, when discomfort get corrected, the life force itself will clear the endometriosis. And we have seen after the vaccination, the endometriosis is more. And we have seen even the same Crotalus horridus has cleared the endometriosis. Unnecessary growth, of course, this is. In cases of IVF and IUI failures, causes of failure is female age. As I told you, age is not the criteria for this. But we can, if we correct their miasmatic background, they become fertile. Same embryo quality. Embryo quality is not good. Why that embryo quality is not good? Once again, it is the syphilitic miasm which destroys the normal growth. It is the syphilitic miasm has the tendency of destruction, either self-destruction, that is committing suicide, or destroying others, because they in many cases we have seen the friend has not given him either the liquor or 10 rupees, they have murdered him. That tendency of killing others and tendency of destroying themselves is typical syphilitic miasm, and all the normal growths are destroyed by the syphilitic miasm. Embryo quality, ovarian response. So if the ovarian response is not there, once again see all the destructions, even the autoimmune implantation issue. While implanting also, if the uterus is not ready to receive it, that receiving ability of the uterus is destroyed by your syphilitic miasm. That's why Hahnemann has done a great thing in studying chronic disease for 18 years, all the cases retrograde, and found the etiology of all the diseases on the earth. We know the reason for each and every disease. We can't say etiology is unknown. We can't follow that. We know the etiology. Lifestyle. If lifestyle is the cause for infertility or a failure, having the same lifestyle, but still the IVF has the success. Is it not? So even following the regime and the diet, there was a failure. Once again, the lifestyle, as I told you, let everything be moderate. That helps them. Nothing should be excess. But same lifestyle is not the cause for failure of IVF. Chromosomal abnormality, once again, there is a mutation. If there is mutation, why the mutation has taken place? It is the miasm that brings the mutation, not the sudden. Risk in IVF and IUI failures, immune testing, once again all the miasms, factors that interferes with IVF is autoimmune disorders. We know if you study autoimmune, they say nature by mistake produces the antibodies on its own cells. How can nature makes the mistake? Nature is so harmonious. It is we make the mistake. And it is the inherited intrinsic factor which is the syphilitic miasm. Usually in our clinic, we don't write syphilitic, we write leutic. Because even while discussing with the students in front of the patient, we say it is leutic miasm. We don't say syphilitic miasm because now there is a GM, no general manager, no Google mania. So the moment we say syphilitic miasm, they go and search syphilis. Oh, doctor said I have the syphilis. But they don't know the difference between miasm and the actual disease. So to prevent this confusion with the patients, we say it is leutic miasm. Same with the cancerous condition. We don't say it is a cancerous constitution. We say it is red mole constitution because cancer patients have more red moles, sensitive to mosquito bite, severe pimple at the tip of the nose, dark pigmentation, acidity from more coffee, allopathic medicines, and disproportionate weakness. This gives the clue for their cancerous tendency in the body. Tendency. That tendency may sprout in that life or may not sprout. Because many cases we have seen, in spite of chain smokers, they have died without cancer. In spite of frequent tobacco chewing, they have died without cheek cancer. Saint Ramakrishna Paramahamsa died of throat cancer. Ramana Maharshi died of throat cancer. What they have done? So it is the tendency which make them to, these tobacco or smoking works like a manure, but seed is what we call as the miasm. So this constitution brings the thing. Same way, the autoimmune disorder, we have treated multiple sclerosis wonderfully. They have, where the doctors have told that you will lose your eyes, you will lose your leg, you must learn to move on the wheelchair, and you practice blind folding, so that in future it will not be problem. We have seen after treating, they have wonderfully moved about, their lesions have come down, and their quality of life is beautiful. So don't think that we cannot treat the multiple sclerosis, because there is a counseling center of multiple sclerosis in America. They just do counseling, but we can cure it. So these autoimmune disorders get clear with your syphilinum. Infertility in males, small testis, we have seen, if you read capsicum, capsicum has the capacity to improve the size of the testis. And with, we give Beretta-carb. I usually practice medicine in combination, polypharmacy, that not all, polypharmacy like all cold medicine in one place and all cough medicine in one place. I give one indicated medicine after taking the complete history, finding the PQRS, suitable medicine. With that, I give one catalyst which enhances the work of the indicated medicine. With that, I give a nosode so that miasm also keep getting cleared simultaneously. Indicated medicine works faster because of the catalyst. This idea of catalyst, we got it from my senior doctor, Dr. A.V. Krishnamurthy, because if you study lycopodium in Clark, he says if you give a dose of carbo-veg, the work of lycopodium enhances. Whenever an indicated medicine fails, you give Tuja, you say. Whenever indicated medicine fails, you give sulfur. Like that, for example, I just say in acidity. After taking all the acidity complaints, let us say you come across Calibike. Just it is for example. With the Calibike, we give calendula because of the acidity, the mucous membrane in the stomach gets eroded. So calendula has the capacity to bring back heal the wound faster. So Calibike works faster. Calendula helps in clearing the mucous membrane, and we give carcinosin because that depth of acidity is due to the carcinosin condition. Now we have seen earlier days we used to give one by one because even we had the idea that one medicine to be given. Then after giving these medicines, we used to get the improvement for 6 months. Then we thought, why can't we give indicated medicine and the catalyst alternate and the nosode intercurrent? Then we could see the improvement in 4 months. In some cases, we gave all the three. Whatever expected improvement was there, we started getting in 1 month. So why should we make the patient to suffer for another 5 months? So we use this technique of combination while prescribing the medicine. Even varicocele, in many cases where they have said you have grade 3 varicocele, your penthorum, if you read penthorum in your Clark, he says varicocele. We have seen where they have advised for surgery, the surgery could be avoided. I was telling Dr. Prabhakar, you have made me the head of the department of surgery, but there should be a slight change in the nameplate. It's not the surgery department, it is the surgery prevention department. And you know, erectile dysfunction, early ejaculations, Agnus castus, Lycopodium bovista, Bufo, and Yohimbinum, these things also will help. Sluggish motility. In sluggish motility, usually they have seen acid fast. But we have given helix tosta on the basis of doctrine of signature. where the mortality has increased. When there is a sluggish in man could be corrected with helix tosta, why not the sperm? So helix tosta could be correct, this rather sluggish mortality could be corrected with helix tosta. Azoospermia, you have seen azoospermia with X-ray, zincum met, these things are helping. I am not teaching you the whole materia medica, it is only for examples I am telling. Emissions without ejaculation. This condition I could get only 2 cases so far in my 33 years of experience. Both got conceived after treating the mare because they were getting the emission, it was not getting ejected out. If you read your materia medica Murphy, he says this in lachesis. After lachesis, the very next month there was conception. One of the lady was a daughter-in-law of the allopathic doctor. He expressed this and she conceived after this. So let me show 1 or 2 cases where we have treated with the platinum. Over? Huh? 5 minutes. 5 minutes will finish. It's almost coming to the end. I will just show you the cases. See, this is Samarth, age around 34 years, trying for conception from 6 years. Rise, Mati. In a male Mati. Barley. Along the yellow, 1 minute, please. See, intercourse, outflow of semen present. We have written in a male. Okay. Thyroid dysfunction from 7 years, notice mild hair fall. And one thing we want to say is, while taking the case history, don't write known case of diabetes, known case of thyroid, known case of hypertensive. Write diabetic known due to, because each diabetic patients are not same. One notices their diabetes due to the delayed wound healing. Another notices due to the sudden weight loss. Another notices due to the sudden blurring. So what made them to notice their more important for us for the selection of our medicine? The word diagnosis or the name what they give has no clue for the selection of our medicine. It is only for the management of the case or the presentation of the case, not for the selection of our medicine. And you can see AMH is low. Medicine. In the male. Husband normal. In the male. So, there was 2 courses of COVID vaccine. That's why Crotalus horridus was given. Low AMH was there. So Mac Police worked like a catalyst along with that. And CARS, because of the family history of carcinosin was there. More histories of carcinosin. So we gave carcinosin as a nosode. In a male madlis. In a male barley. Wait 1 minute. Once again it was repeated after 10 days medicine and 10 days gap. Now you can see they were trying for the past 6 years. UPT positive. Next. Solpa milk. Saku. Single live intrauterine pregnancy of sonographic gestational age of 8 weeks. So these things also will help. Next case. That's sufficient. It's only 2 minutes. Because of the running out of time. See, first we ask whether they have taken the COVID vaccination or not. We take COVID vaccination, 3 doses is done. Sir Bunny, trying for conception from 5 years. Male Bunny, sir. In the milk. Wait. Thyroid variation. We take all those things. And now you see, we take outflow of semen during intercourse. That is a must. Then, no pain during intercourse, dryness of vagina from 1 month. Right. In a male ugly, sir. In a male. TSH, in a male barley. Walls of uterus, beta. ಇರಿ ಒಂದು ನಿಮಿಷ ಬರ್ತಕ್ಕೆ ಇನ್ನೊಂಚೂರು ಕ್ರೌಡಿಂಗ್ ಇನ್ನೊಂಚೂರು ಕೆಳಗೆ ಸ್ಟ್ರೆಸ್ ಇನ್ ಪೇರೆಂಟ್ಸ್ ವಿತ್ ಮದರ್ ಇನ್ ಲಾ ಇನ್ನು ಮೇಲೆ ಹೋಗಲಿ ಸರ್ ಮೇಲೆ ಹೋಗಲಿ ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದಿ ಸ್ಟ್ರೆಸ್ ಮೆನಿ ಟೈಮ್ಸ್ ವಿ ಹ್ಯಾವ್ ಗಿವನ್ ದಿ ಮೆಡಿಸಿನ್ ಆನ್ ದಿ ಬೇಸಿಸ್ ಇಲ್ಲ ಡೌನ್ now you can see there is 5th month gestation. There was one abortion because the tendency of abortions could be corrected with usually eupatorium purpureum will take care of the tendency for abortions, but after giving eupatorium perfoliatum with syphilinum, as I told you we write luticum, with syphilinum and bertacarb, she had conceived and delivered.
Of female reproductive system as well as the male reproductive system and techniques of prescription. It was thought-provoking, deeply informative and full of practical wisdom. We truly appreciate your valuable knowledge, sir, to share it tonight. So, I invite our chairperson, Dr. Bindu Sharma ma'am, on the podium to address the gathering and review the session.
Good morning, all the distinguished guests, my colleagues, dear friends, and the students from Government Homeopathic Medical College and all the government colleges in Bangalore, Karnataka. Now, it was a great honor and privilege to be at this scientific session organized on World Homeopathy Day 2025 by Karnataka Homeopathic Medical Association. I am greatly honored to be here, invited as the chairperson of this session. Thank you, Dr. Veer Brahmachari and all the others. I'll particularly thank Dr. N. Madan, sir, for this enriching session. I express a heartfelt gratitude to him for his insightful presentation. Today's discussions, they have reaffirmed the complexity of reproductive health challenges, the clinical advances in homeopathy, on infertility and varied disorders that can, complicate pregnancy outcomes. The rising cases of infertility because of vaccinations, that was a well-emphasized observation. Especially, it has been noticed by Dr. Madan, who is treating a large number of patients every day, that COVID-19 vaccine 3 doses, they have been responsible for a majority of these infertility disorders and pregnancy related complaints. To this, I would like to add another important factor, and that is PCOS, stress. PCOS, again, it is a lifestyle disorder which has been mentioned by Dr. Madan also. And stress, of course, late marriages because of the corporate culture. These days, the youngsters, they are not getting married at the proper biological age, which is around, between 20 to 25. They will delay the marriage. As a result, the conception will be late. And this, again, leads to infertility, because the biological age, when you tend to cross the biological age, then the conception becomes all the more difficult. Homeopathic treatment, which adopts holistic approach, considering physical, mental, emotional, social, and spiritual aspects of a person's health, not just treating a disease and symptom in isolation. This practice has been well emphasized by Madan sir, that how we can treat these reproductive complaints like infertility and pregnancy related disorders by considering stress, lifestyle, nutrition, emotional well-being, relationships, and even environmental factors that may be affecting fertility. And this is, of course, the need of the hour. His technique of individualized medicine, catalyst, and then no swords has unfolded a revolutionary approach to homeopathic treatment. And at the same time, the common kitchen remedies which were mentioned by him as tips like tamarind, mustard, etc., and at the same time useful rare remedies like helictosta, panthorum for varicocele, and other magnetis poli. So these, they have added a real value to his session, and they are really appreciable. So I thank you, Dr. Madan, for this enriching session, and I deeply thank all the speakers, the speaker, for making this session so impactful. And on this World Homeopathy Day, let us move forward with greater knowledge, compassion, and dedication to improving outcomes for all the patients. Because as we know that infertility is not only a clinical challenge, it is a social, public, and a compassionate challenge for all of us. Thank you so much for inviting me here.